In our rapidly evolving world, success is defined by turning challenges into opportunities. With enough foresight and ingenuity, the complex problems of today can become the achievements of tomorrow. I'm Fred Thompson. From business and technology to healthcare and the environment, join me as we take a closer look inside the workings of the modern global economy. Welcome to Inside Business. I'm Fred Thompson, and I'm Inside Business. From insurance carriers to healthcare providers, from government programs to employee benefits, healthcare in America has become a major issue. Let's learn what's being done to ensure the health of a nation remains in good hands.
Long wait times for emergency care are among the many challenges that patients face these days. Surprisingly, some of the shortest wait times are taking place in some of the country's busiest emergency rooms.
There are 4,500 emergency departments that see over 120 million patient visits a year. But we don't just see patients for emergencies, we see patients that can't be seen anywhere else. In other words, with a safety net for the hospital system.
It wasn't that many years ago that the emergency room was somewhere in the background of a hospital, and it certainly was not a focus of the healthcare delivery system. But now the emergency department is very much a focus. It's the front door, and it takes care of not only the acutely sick and injured patients, but also many patients that can't get their health care needs met easily in the community. So it's the front door, and it's also the safety net for America's healthcare system.
What kind of trouble are you having today?
Wait times are a major problem across the United States for all emergency departments. Opelousas General with the Schumacher Group, I think, has taken an innovative approach to that, and basically we've flipped the system upside down.
So rather than patients waiting a long time to see the care provider, they actually see the physician or nurse practitioner first.
I think there are several advantages to having the physician or the nurse practitioner see the patient first, because therefore they can immediately order tests and start the assessment process. This lends for a speedier process through the system. I think allows for much shorter waiting time, and I think also increases the satisfaction level to our patients.
Having spent many years in the emergency room himself, Dr. William Kip Schumacher is aware of its challenges.
Doctors see about 1 billion patients a year in the United States, and we need systems in place to make sure that the quality of care is being consistently delivered. And if there is some kind of deviation from a standard, that we can intervene.
His Lafayette, Louisiana-based company, Schumacher Group, employs innovative technologies and solutions designed specifically for the ER.
With healthcare evolving as rapidly as it is now, innovative solutions are required to get the data in front of the physician so the decision support is there, so that the patient will get the highest standard of care available. And after the patient leaves, we can look back at the care that was delivered to see whether or not optimal patterns are developing and give that information to physicians for the next patients that trust us.
Solutions include ER staffing, as well as business intelligence and technology interfaces.
In a way, we're revolutionizing what information is shared, how it's shared, and how fast. We're establishing best practices and strengthening the bonds between the people who touch the patients, all the way from the physician at the bedside to the registration clerk through the entire patient experience.
Dr. Flip Roberts is a chief medical officer at a Schumacher Group facility, Baton Rouge General Medical Center, where ER patients are enjoying the benefits of technology.
At Baton Rouge General, we're very proud of the technology and high-touch atmosphere that we have in our emergency department. And we're able to have a completely paperless electronic medical record now in the emergency department, which gives us the ability to convert lots of data into meaningful and useful information very rapidly. In addition, our website has the opportunity for patients to go online and see what the wait times are real time and access our emergency department.
But it's the technologies that the patients never see that lead them to having a better care experience.
As physicians, we realize the critical role of data and information in caring for our patients well. And the key is to bring the right information at the right time to the physicians when they're making decisions for their patients. And if we do that well, the patient's experience is better. They get 100% of the physician's attention when they need it most. And the quality of that care is improved as well.